Hello, my name is Instructor Williams, and today I'll be going over Progressive Airway with you. The first thing you're going to do before we start this skill is we're going to go over all the equipment. First thing is we're going to go over the oxygen tank. The oxygen tank is green. Make sure we understand that. We're going to inspect the regulator. Make sure the flow meter turns and it has a washer on the inside and its integrity is intact. Next thing we're going to do is go ahead and line it up on the oxygen bottle. Sometimes it can be a little bit difficult to get it in there. Don't worry about it. Just go slow and put it on. Next thing we're going to do is we're going to go ahead and open up the oxygen tank. Make sure it reads 2,000 psi. We're then going to go ahead and crack the flow meter just to quickly bleed it real quick and then turn it back to 0. So we're going to go ahead and lay the oxygen tank back down. Next thing we're going to go through is making sure we have a nasal cannula. Nasal cannula is 1 to 6 liters per minute, 24 to 44% oxygen. Next device up will be non-rebreather mask. The non-rebreather mask is 10 to 15 liters per minute and 70 to 90% oxygen. The next device we'll talk about is BVM. BVM is 15 to 25 liters per minute and provides 100% oxygen. We have a variety of oral pharyngeal airways available for testing, and I'll go through that on measurement as we go through the test. You'll make sure that you have nasal pharyngeal airways, and we will also go through that as we go through the test. Then our suction device. We're going to make sure that the battery is charged and working. It is hooked to our suction device with our tubing and our Yonkers tip. We're now going to go ahead and start the skill. First thing we will do is BSI Pin Man. Your paramedic partner instructs you to put your patient on 2 liters nasal cannula for difficulty breathing. You'll locate the nasal cannula. You'll hook the nasal cannula up to the oxygen. You'll turn it on to 2 liters. You'll explain to the patient what you're doing. You'll make sure that the tongs are towards or with the patient. You'll slip that in, go around the ears, tighten it up. Now we understand that this mannequin doesn't have ears, so you just simply hold it. Next, your paramedic partner will tell you your patient is having more difficulty breathing. At this point, you're going to go ahead and take him off the nasal cannula, turn it off, disconnect the nasal cannula, move it away. You're going to locate the non-rebreather face mask. You're going to plug it in. You're going to turn it to 10 liters per minute. You're going to cover the valve, filling the bag prior to putting on the patient. You're going to explain to the patient you're giving him supplemental oxygen to help him breathe. You're going to go ahead and put it on, tighten up the string, make sure it's got a nice tight seal on it. Partner now informs you that your patient has gone apneic. At this time, you're going to move him out of the sitting position in the chair, lay him flat, okay, on a hard surface, preferably the floor. You're going to locate your BVM, your bag valve mask, and your appropriate size OPA. You're going to remove the mask. You're going to measure from the tip of the earlobe to the corner of the mouth, selecting the appropriate size OPA. Come to the head at 180 degrees, insert and turn, inserting the OPA. You're going to unhook the mask and go ahead and plug in the BVM and increase your liters per minute to 25. You will come to the head, make sure you get a nice tight CE grip, and you will ventilate every 5 to 6 seconds. You want to make sure you have a good chest rise. That's how you know you have a good seal. At this time, both you and your partner notice that your patient is vomiting. You're going to stop ventilations, turn him on his side, remove the OPA, let gravity do its thing and flow any vomit out, You're going to go ahead and get your suction unit, turn it on, cover the carburetor, make sure you have suction. You're going to lay him back down flat, measure from the tip of the ear to the corner of the mouth, mark it with your finger. You're going to insert, then you're going to cover the carburetor with your thumb. You're going to suction for no more than 10 seconds on the way out. Once that airway is clear, airway is now clear, you're going to select the appropriate size nasal pharyngeal airway. You will measure it from the tip of the nose to the corner of the ear. You will loop the airway. You will now come to the head, bevel towards the septum, and rotate it in line with the patient's airway. That's now in, and you will resupport ventilations every 5 to 6 seconds. Again, watching for good chest rise and fall. That will complete your progressive airway station.